Hi, everybody. Thank you for joining us for another episode of Cheers for Charity. My name is Lisa Kessler from Kessler Insurance. And on behalf of Joanne Burchuck and I, thank you for coming and learning more about another fantastic organization. Joanne, great to see you today.
Yes, thank you. You too, Lisa. Hi, I'm Joanne Burchuck, and I'm with Lighthouse Physical Therapy. And I'm very excited to introduce today Molly Zarillo. And she is with, it's a long name here, so let me see if I can get this right, the Society of St. Vincent de Paul.
Correct.
Did I miss a word? No, I did it right? So Molly, please just tell us a little bit about what the organization does.
Sure. I'll give you a little bit of background because it's a major international group. We're a Catholic-based organization. Then I'll bring it down to Exeter too. It's too overwhelming to try to absorb the whole earth. But St. Vincent de Paul was started by some Sorbonne students in Paris, France. The story goes that they were sitting around the pubs talking about, well, what are you doing to help people? What are you doing when there was so much abject poverty that was surrounding them? And a couple of the college students actually got this going. It started out very small. They would visit people's homes, bring them breads, bring them money, things like that. But it is a big lesson in what just even a few people, the effect that can change, how much of an impact that can have on just their community. But now, like I said, that this is an international organization. St. Vincent de Paul is present in 150 different countries currently. The list of countries that we're not present in is a lot shorter. And how that is done is a little bit different in each country and each state and things like that. But what I want to do today is talk about what we're doing here in Exeter to help our neighbors in need. So we started in Exeter 30 years ago in 1989. It was becoming abundantly clear that there was not enough. There were people that were coming forth that were hungry. They were poor and they were hungry. There was not adequate foods. They didn't have enough resources and things like that. So a small group of parishioners at St. Michael's got St. Vincent de Paul underway here in Exeter. And it started out in pretty humble beginnings. They borrowed some space from the church and things like that. And they started the food pantry for the Exeter area community. But it became abundantly clear pretty quickly that just providing material goods for people that are in need was not sufficient. They also would be much better served if we connected them with critical tools and resources and services that would try to get them out of poverty. So here we are, almost 31 years later. We are located on Lincoln Street in Exeter, right across from the train station. Lots of people go by us and not everybody's 100% sure what we are. And under normal circumstances, I'd be inviting everybody in for tours, but unfortunately we can't do that right now. But we are a food pantry and a community assistance center. We collaborate with a number of different local nonprofits and agencies to bring help to our neighbors in Exeter. This is pre-COVID too, so not right this minute, but pre-COVID. We collaborated with CAP. We had a homeless outreach person that was there on Mondays. We did tax preparation services through Vita Tax Preparation. We collaborate a lot with Families First. We have had a staff member there that does Medicaid enrollment for folks. We also have my terminology is a little wacky. We have a medical professional that comes out on a weekly basis it's a doctor and a nurse and a social worker to help with folks that are homeless or near homeless on Wednesdays. On Thursdays, we have a representative from CAP that does fuel assistance. And on Fridays, we had our dental van. Lots of you have probably seen the big dental van that's parked next to our building that was donated by Exeter Hospital. So we have a lot. I won't expect you to remember all that. It's a lot I threw at you. But we have a lot of different encompassing services. We are pretty unique in that lots of other organizations are hyper-focused on one initiative, but what we try to do is come at this in a little different perspective where we're trying to surround, again, folks in need with different services, because what we want to do is try to get people out of poverty, to be able to get them to where they need to be stabilized and self-sufficient. So we do that through a number of partnerings. We do that ourselves. It's, basic, what mostly we're known for is our food pantry. We were pre-COVID open 5 days a week, 52 weeks a year, but we're now open 3 days a week and doing that. We're doing curbside delivery. So folks will pull up, give us a buzz, and we'll run food out just to keep everybody safe. But that's a real basic premise. If people are hungry, if they don't have sufficient monies to buy food, if they're hungry, you can't fight diseases, you can't get a job. I mean, it's primal, it's basic. I was a stay-at-home mom here in town in Exeter, and my kids going through the Exeter public schools kind of opened my eyes to some of the situations that other families were facing, and I wanted to do something about it. So I got involved with St. Vincent de Paul and became a volunteer almost 10 years ago. Then I got sucked into the vortex and became their first paid employee. Currently there's myself and 2 other part-time employees, and we rely on volunteers. So it's a very community-based organization that we could not survive without the generosity of the volunteers, of our donors, of people that give in-kind things. It's a horrible business model. We give food and money away. It's a horrible business model. So we have to rely on the kindness of others. And so where we do not charge for any of our services or fees or anything, any of the folks that I'd mentioned that come in to our community assistance center, we don't charge rent or anything like that. So we sustain off of the donations that we receive from our communities. And that's how we're able to stay in business. We also work pretty hard to make sure that folks are aware of the poverty that exists in Exeter. Lots of people, cruise downtown and say, what poverty? There's no poverty here. It's pretty well hidden, but it does exist. It does exist. We help a number of homeless people. There's I believe we had about 137 homeless people that came through our doors last year on Lincoln Street. So there's a lot more poverty that we are surrounded by that's not, again, overtly obvious, not like in an urban setting, but it does exist. So our job is to try to help people out and provide them with basic necessities like health and food and things like that, but also to get them in touch with the services and tools that they need to get themselves out of poverty. So in a big nutshell, that's what we do. And we're grateful for people that are interested in learning more about what we do, how people can come to our services. Our food pantry is open right now to members of any residents that reside in any of the SAU 16 towns. And we are really generous right now because of this. COVID-19 has put people in a lot of predicaments that they normally found themselves in. But we welcome anybody who's interested in learning more about us. We have a great website, or if somebody's interested in, qualifying as a client, just give us a buzz. We'd be happy to get you enrolled and things like that. So that's kind of, again, in a long nutshell, what we do and how we do it.
Yeah, so you have a really focused area that you're working with. How do you determine whether somebody is eligible or not eligible? Is it, just based on, well, especially when you're dealing with the homeless, they could be anywhere.
Our food pantry, and we also do direct financial assistance, emergency financial assistance to folks. We're the last ones. All other resources have been exhausted. We work very closely with town welfare and lots of, women aid and things like that. We're all in this messy, sloppy business together. So a lot of, it's helpful when we can communicate. And sometimes we just have to cobble together enough monies to get somebody to stay in their home or whatnot. So the food and the direct financial, they have to be residents of the SAU 16 towns. Outside of that, if you're homeless, you don't have a home. If you're seeking medical care, all those other kinds of things, there's no residency restrictions for that. So it's kind of 2 qualifications that we have. And if somebody comes to the food pantry, or gives us a call and wants to know if they can come to the food pantry, we find out where they live, and if they say they live in Raymond or Epping or whatnot, we have a whole catalog of the different food pantries that are available in their community. So we always direct somebody where they can get the assistance that they're seeking.
Now, is your food pantry stocked mostly from donations, or are you part of, I know there's like Gather for New Hampshire, are you able to pull from their resources also?
No. Gather is a nonprofit that serves, like, they have a vast area that they serve, but the New Hampshire Food Bank in Manchester distributes to food pantries. It's kind of like, a lot of people get those confused, but a food bank distributes to food pantries. Food pantries distribute to clients directly. So we go to the New Hampshire Food Bank in Manchester once a week and pick food up from the New Hampshire Food Bank, and it's very, very reasonable. Sometimes, depending upon what the items are, sometimes it's free, but typically for every dollar that we receive, we can parlay that into approximately $50 worth of food purchases at the New Hampshire Food Bank. And I fancy myself a savvy shopper, but I can't come close to that. So we can do a lot more with financial donations than we can in-kind donation. We're happy for everything. Again, that's how we sustain, but we are able to do a lot more. So we go to the New Hampshire Food Bank. In town here, Exeter, Hannaford is incredibly generous to us. We pick up their day-old pastries and breads and things like that, as well as their frozen protein. So they are incredibly generous. We're very fortunate to have that. And then in turn, we can be very generous to the people that we're serving through that. We have to purchase some food items sometimes, like, things like coffee. People don't really think to like donate that often, but that's how most people start their day. And just because your income is at, at a lower level doesn't mean you're immune from being addicted to coffee. So things like that. So it's a myriad of things. And then there's also a number of organizations that have annual food drives for us. And then it just kind of comes in drips and drabs. People come and bring things to us. So it's a number of different organizations and different varieties of ways that we are able to keep food on our shelves. And again, I would invite you in if you could come in. But people think of a food pantry and they think of like a church basement, and we are completely independent of the church. We are an entity unto ourselves. But we do offer, we purchase milk, eggs, and butter. We have fresh produce. This time of year, we are welcoming any fresh produce that's donated. And so we're able to provide that as well. But then we have the meats, and then, normal pantry items, pasta and tomato sauce and a whole myriad of things like that. But we also do provide personal care items like laundry detergent, shampoo, soap, things like that, toilet paper. And those are items that are not covered under SNAP benefits or food stamps. Most people are familiar with that terminology. Those are not covered. So when you go to the grocery store and money is tight, that's going to be one of the first things to get cut off your list. Last year, we spent approximately $14,000 just on personal care items. But it's important because I know when I go to the grocery store, like everybody, everyone's needs are the same. So we want to make sure that we can provide folks and families with things that we do. Right now, we've started before this too. I should mention that we do deliver to area seniors that reside at 277 Water Street as well as Meeting Place. 277 Water Street was, we started out beforehand. Now it's just been compounded because of this fun pandemic we're all in. We do deliver to them directly. Some of those folks are housebound. We're not able to get out even prior to this, but now we're doing that as well. So we want to make sure that we're taking care. We look at that as some of the most vulnerable residents, in our community. So we want to make sure that they have what they need, as well as some of the typical summer months. We allow families to come in on a monthly basis to come in and get food. We want to help with that. What we don't want to do is have people create dependency issues. We don't want to be their alpha and omega. We want to make sure that they're applying for WIC. We want to make sure that they've applied for food stamps, things like that. But now, again, everything with this, COVID, now we've allowed anybody that needs to come in on a weekly basis can visit us on a weekly basis.
Yeah. Now, it sounds like a lot of your other services you've had to stop during this whole pandemic. Do you see a time in the near future where you're going to be able to start to offer those services again?
We don't have anything in the near future yet. We're kind of piecing some things together slowly but surely, and we're at the mercy of who's coming and things like that. But we have to be very careful. A lot of our clients are compromised. So we have to be very careful about that. And some of our volunteers are older. So we have to be careful. I mean, we're in conversations about that, but then they're also at the mercy of their organizations when they feel safe because, for example, the New Hampshire Food Bank is closed to volunteers right now. And they're considering opening up in September, things like that. So everybody's kind of feeling the waters a little bit. We're, you know, starting to communicate and make noise about that, but we don't have any hard and fast dates right now.
And well, all of it. It's so fascinating, Molly. I mean, you guys do a ton of good work. How many, you know, when you are normally functioning, how many volunteers are you using on a given month or at a certain block at a time?
We have 130 volunteers, but we probably, I mean, realistically, probably have about, I'm kind of making this up, but I mean, somewhere in the vicinity of like when everything was cooking and everything was going, we probably have about 40, 45 active volunteers that are coming in like weekly and things like that, because we have folks that come in to volunteer that want to serve the clients directly. And some people are not comfortable with that. Some people want to do supportive roles like stocking or driving or things that are behind the scenes. So there's room for everybody there. But again, we would not be able to survive without our dedicated volunteers. They're a big piece of what we're doing.
That's fantastic. You guys do amazing work. You make a huge difference in all the places that all the people that you help in the outreach. And I know things are a little more challenging this year because you can't do some of your typical fundraisers and those kinds of things. So if people are watching this and want to learn more, and I think you covered this a little bit, but where do you want them to go?
They can go onto our website. It's svdpexeter.com or Society of St. Vincent de Paul Exeter. You can Google that. And that outlines our different programs and how things happen and things like that. So that's, or if they were interested in donating, which we need, there's a link to do that as well online.
Do you also post on there what your preferred items for donation are?
We do, yes. Yeah. There's a current list right now, and you could also follow us on Facebook. So we put like updates and things like that as well on there. So we do that. Or if somebody has a specific question or what have you, you know, feel free to give us a call. We'd be happy to help you out.
Fantastic.
Very nice.
Awesome. I would just think what you do is fantastic. I think it makes a big difference, especially now more than ever, as you suggested. So thank you to you and your team for what you do. Thank you for joining us and telling us more about it so we can help get the word out for you all. We really appreciate your time.
Well, I appreciate the opportunity again to share what we do in the community to make sure that we're helping as many people as we can and keeping everybody safe and fed and all those kinds of things. And again, if anybody's looking for more information, don't hesitate to get in touch. We'd be happy to help you out.
Wonderful. Great.
Thank you so much, Molly. It was such a pleasure speaking with you.
Thank you. Yes, nice to have met you.
You as well. Take care.